You like my dress? It has pockets, but do you know what doesn't have pockets? DRESS syndrome. DRESS syndrome is drug rash with eosinophilia and systemic symptoms. And this is a severe illness that we have to recognize quickly, but it's pretty rare. So let's talk a little bit about it so we could actually recognize it if we ever see it in our patients. DRESS syndrome is a severe systemic reaction to a new kind of medication. And usually it's anti-epileptics, but it can be any medication. And it's theorized that the cause of DRESS syndrome comes from a patient having some kind of deficiency that doesn't allow them to clear or get rid of a medication in their system. And so we don't see this happen right away, like with an allergic reaction on the first exposure to a medication. It's usually anywhere from 2 to 8 weeks after a patient starts a new medication. And the symptoms that we're going to see that are classic to DRESS syndrome are fever, a rash, and eosinophilia, which means if you get the lab values on this test, look at those eosinophils, that's a subtype of our white blood cells, we're gonna see drastic elevation in that. But we also see signs of end organ damage. So it might be liver failure, kidney failure, problems in the lungs, some kind of severe end organ damage with that eosinophilia, fever, and lymphadenopathy. So how do we manage these patients? First of all, we're going to stop that offending agent. Whatever new medication they've got, let's make sure we stop it. Then we usually give a dose of corticosteroids to help try to tampen down that massive inflammatory reaction, and supportive therapy. Like if they need their airway controlled, we intubate them and mechanically ventilate them. So there you have it, DRESS syndrome. And hopefully your day brings you a dress with pockets.